There is definitely a relationship between celiac disease and irritable bowel syndrome. We know that if you test everybody with irritable bowel syndrome, somewhere between 3 and 5% of patients will have celiac disease, so it's well worth testing for, and most national guidelines will suggest that this is worth testing for. And if you look at other tests that we quite often employ in irritable bowel syndrome, like colonoscopy and various other things, these have got much lower chance of making a positive diagnosis, so I think it should be definitely one of our first line tests for irritable bowel syndrome. So the question is whether patients with irritable bowel syndrome should reduce gluten as a first option. I think that certainly not everybody with irritable bowel syndrome has gluten sensitivity, but it's certainly something that is worth trying. Once you've excluded celiac disease, I think there's lots of different things that are worth giving a go, including a low gluten diet or a low wheat diet before probably trying a FODMAP diet, because a FODMAP diet is quite highly restrictive, whereas just reducing wheat or just reducing gluten may be a best first step. So I think it is something that is certainly worth trying, although it isn't going to work for every patient. So should a healthy person reduce gluten in their diet? I think if a patient has absolutely no symptoms, then there is no reason to reduce gluten. There's no real evidence that it's going to cause any long-term harm. There is lots of different problems that gluten can cause, including celiac disease and neurological problems and things that can be related to gluten, although that is quite uncommon. So the vast majority of the population are perfectly safe to eat gluten and wheat in their diet, and forms a healthy part of a balanced diet. So a take-home message really from today would be that the most important thing really is test everybody with irritable bowel syndrome for celiac disease. Once you've done that, a gluten-free diet or a wheat-free diet probably is one of the best things to try as an elimination diet first, but it isn't going to work for everybody, and I think that's really where we need to go from here.